The definition of active labor is when a person in labor's cervix is dilated to 6 centimeters. It used to be 4 centimeters. It's kind of arbitrary. But if you've noticed your partner has become less present during contractions and she's really having to focus in between, this shift in behavior is a good sign she's in active labor. She might also make less eye contact during and between contractions. That's okay. Let her be in labor and focus however she needs to. If she starts to become hysterical, then you may need to get her attention and force that eye contact while you bring her back and ground her. Another behavior shift is if she's having to concentrate more during contractions, and it takes more effort to relax and find her rhythm. If this happens, your job is to help her find her rhythm or find one for her. This is one of the best ways to cope with the intensity of birth. So if your hands are on her doing the double hip squeeze, which we'll talk about in the comfort measures video, encourage her to sway back and forth. This helps keep her loose and open and helps the baby navigate the birth canal easier. If she's holding on to you, slow dance style, start to sway back and forth. Whatever position she's in, try to keep that rhythm consistent when possible. And always encourage her to have a slight bend in her knees. She may stop walking and talking. This is a good sign she's focusing. Let her be, but gently encourage her to try different positions every 30 minutes or so. When she stops talking during contractions, take her lead and make sure she's not being asked questions during contractions if the nurse or provider asks something. If it's important and you know the answer, you can answer in a whisper. If not, ignore the question until the contraction is over, and then it can be addressed. And hopefully they will get the hint quickly. She may start tensing up in between contractions in anticipation for the next. And she may start dreading the contraction or fearing them or try to hide from them. Help her refocus. Tell her to soften, open, loosen, words like that. Telling her to relax is not ideal, and it's honestly really annoying to hear that in active labor. But if you see her holding tension somewhere in her body, like say her shoulders, if she's like this, put your hand on her shoulders, take a deep breath, and encourage her to soften. One great piece of advice is to remind her to loosen her jaw. And that will usually help her entire body to let go a little bit. I hope you just did it, and I hope you felt how powerful that simple cue was. If not, try it now. Keep encouraging her with phrases like, "You're doing so well, you're so strong, one contraction at a time," etc. Another shift is that she may need more physical support during contractions. Some women hate being touched during labor, and others you have to be hands-on every single contraction. She will tell you what she likes and doesn't like. Remember the rule about no questions during contractions? That applies to you too. And never take anything she says or how she says it when she's in labor personally. Different things feel different during different stages of labor. If she likes something in early labor, she could hate it during active labor. Just take her lead, and again, don't take anything personally. The next video will go over some great comfort measures that you can try to help alleviate some physical discomfort during these intense contractions in active labor. She may begin moaning or vocalizing a little or a lot during contractions. This is great. You can vocalize with her, especially if her moans become higher pitched. You can remind her to stay low, which helps keep the body relaxed and open. So more like this, oh, and less like this, ah. Get it? She may feel exhausted and discouraged and start to cry. Birth is hard. They definitely don't call it labor because it's easy. Most of my clients say, "I can't do this anymore," at some point. I remember saying it during both my births. I'm going to let you in on a little secret. Most of the time when a laboring person says, I'm done, I can't do this, they are in transition, which is the hardest part of labor. Usually when she gets past this part and she starts to push, and then she gets to meet her baby and the pain is over just like that. So to help her get through this part, more encouragement. You are doing it. You're almost there. You're doing so great. Every contraction is bringing you closer to your baby, things like that. Another thing you can do is to help her quiet her brain. Look around the room and see what may be inhibiting her. Maybe the lights are too bright. Is she being watched? Is the music too energetic? Is she being asked too many questions? Is she worried about something? I remember during my first birth, at one point in active labor, the nurse had a really hard time finding my baby's heartbeat. I could hear her whispering to my midwife, and all I could think is my baby okay? But I couldn't really verbalize a question, and that worry slowed down my labor. Everything was fine. They just had a harder time finding the heartbeat because the baby was so low, about ready to be birthed. But if you can anticipate these needs and worries and act on them, this will help your partner so much. She should not have to use her brain at all, especially when she reaches the active labor stage. She needs to have her logical brain off and be completely in her primal brain. I have another acronym for you to remember and remind your partner of, and it's PAIN. I'm going to be honest, most labor is painful. Probably no surprise to you. Whenever pain is present in the human body, what's the purpose? Usually it's to tell us that something is wrong, right? But in labor, pain is completely normal, expected, and safe. Remember the purpose of labor pain? It's to birth a baby. So it's pain with a purpose. Remember that also. So go back to the acronym, PAIN. Purposeful, anticipated, intermittent. So for every contraction in labor, there's a period of rest. The amount of time a laboring person is actively in a contraction is actually just a small fraction of the time of the whole labor, although it doesn't feel like this. But encourage your partner to take advantage of this rest time. And then finally, N is for normal. So we know pain in labor is normal, safe, and expected, but sometimes it can cross the line into suffering. And when you're doing all the comfort measures and everything else you've learned, and she is still truly suffering, and you, the person who knows and loves her more than anyone, can identify when this is and when you should have the conversation about getting some extra help. Because thanks to modern medicine, women do not have to suffer in order to meet their babies. There are different pain medication options that your provider should discuss at a prenatal appointment, but the most popular is an epidural. While epidurals usually allow for much needed rest, it doesn't mean your job is over. There's still some important jobs you can be doing, which I'll talk about in an upcoming video. I want to talk about transition for a second. Like I mentioned before, it's usually the peak of pain during labor, and this is usually from about 8 centimeters to complete, which is 10 centimeters dilated. Your partner may get lost in the intensity of labor. She may feel scared or seem angry or frustrated, scream, tense, cry, lose her rhythm, and say she can't do it anymore or she needs help. This is where you need to step up and take charge. Make eye contact if you can. Hold her tight, but don't rub her. Let her cry and acknowledge and validate her pain. Remind her that this is the hardest part. Stay calm, confident, and optimistic.